there, today I will be telling you about oppositional defiant disorder. To get started with, let's look at some of the key features of ODD. So ODD is characterized as a disruptive disorder and it exists across three domains of pathology. ODD is characterized by the domain of angry, irritable mood, argumentative, defiant behavior, and vindictiveness. Vindictiveness predicts a more severe presentation of the condition, and the major factors that influence the presentation of ODD is actually the mood aspect, angry, irritable, and the behavioral aspect, argumentative or defiant. The main features of ODD are quite varied and present in different ways. So we will see people who are easily annoyed, angry, or resentful will often try to start arguments or try to annoy people deliberately, will lose their temper frequently and also struggle to follow rules. They will be very stubborn and actively defy instructions from other people. While we often see these conditions in children and adolescents, there are some cases in which we see ODD in adults as well. And we can see ODD in family, social, or educational settings. In fact, the more settings we see ODD, the more severe the ODD is. So we can diagnose ODD by identifying 4 of the following 8 symptoms or more. However, it doesn't matter which symptoms are diagnosed or more than 4, how many are diagnosed. It's just that they are present, 4 of these 8 symptoms. So these symptoms present across the 3 domains. The first domain of angry or irritable mood, and the symptoms are 1, often loses temper, 2 is often touchy or easily annoyed, 3 is often angry and resentful. Under the dimension of argumentative or defiant behavior, we have 4, often argues with authority figures or, for children and adolescents, with adults. 5, often actively defies or refuses to comply with requests from authority figures or with rules. 6, often deliberately annoys others. And 7, often blames others for his or her mistakes or behavior. Finally, with vindictiveness, 8, has been spiteful or vindictive at least twice within the past 6 months. Looking at the other criteria, we have to be able to acknowledge a case where the child presents as unusual for their age, gender, or culture. Most children will present with some kind of defiant behavior at some point in their development. However, it is the frequency and intensity of the presentation that separates this behavior and this mood from what is typical of their age group. This is going to mean that the individual is going to experience some form of distress or impairment in either a social, educational, or even occupational setting. And it has to be acknowledged that this impairment is not due to the conditions of another disorder, which we'll look at in the differential diagnosis. So that leads us to the most significant diagnosis that needs to be ruled out before diagnosing for ODD, which is conduct disorder. These two conditions are highly related and they both involve behavior that is disruptive. However, ODD is considered to be more related to extreme mood variations and affect that is irritable and negative, whereas conduct disorder doesn't necessarily focus on that type of pathology. It is more interested in identifying instances where rights are severely infringed upon or significant harm is intended towards those people are acting towards. ODD isn't so much focused on harm as it is focused on defying behavior as well as that mood component. However, it is important to recognize that ODD is a risk factor for the development of conduct disorder and must be watched carefully in making sure that this does not progress into a further extreme condition. The next one that we need to differentiate between is ODD and ADHD. So ADHD is often confused for ODD as... So the next one we need to differentiate between is ODD and ADHD. ADHD is often confused for ODD as the symptoms of inattention in ADHD may lead to non-compliance. However, it is important to note that in cases of ADHD, this defiance is not intentional. There is no active defiance in place. It is simply part of the inability to focus on instruction. Whereas with ODD is an active defiance. We can observe how a child may actively ignore or divert from certain orders and refuse to follow instructions. ADHD and ODD are considered to co-occur, and they share multiple risk factors, so it is believed that they are a highly comorbid condition. Some other conditions that we need to diagnose or rule out in a differential diagnosis of ODD is firstly disruptive mood dysregulation disorder, which is characterized by more severe and frequent temper outbursts. When we are looking at learning disorders, these can be ruled out through intelligence testing, and learning disorders would typically present with defiance and irritability in the educational context. So at that point, we would rule it out using intelligence testing. And finally, while we may see mood disorders and anxiety disorders with irritability as a symptom, there again is not this component of defiance that comes with ODD. So even if we identify irritability, it wouldn't be enough to diagnose with ODD unless we saw that defiance. So what is the etiology of ODD? There is a combination of biological, psychological, and environmental features that all interact to inform a creation or a encouragement of ODD. So in terms of biological features, 61% of the features of ODD have been identified to be heritable. In addition to this, it has been identified that those with ODD have a reduced cortical volume in brain centers associated with executive functioning. This means that those who have ODD struggle to make effective decisions due to the reduction of these brain volumes. In addition to this, psychological features contribute, specifically related to emotional regulation. When children are unable to understand or regulate their emotions, they may respond with maladaptive internalizing and externalizing emotions. Internalizing emotions is negative internal experiences of one's environment, such as being irritable or angry. And externalizing of these emotions is the presentation of these negative feelings, such as temper tantrums, disruptive behavior, and stubbornness. So this can be heavily associated to how the child kind of perceives and interacts with their environment due to a difficulty in regulating emotion. And finally, environmental features have been identified to heavily influence the presentation of ODD. Socioeconomic status, culture, community violence, peer environment, and family environment all contribute to the presentation of this condition. In terms of developmental pathways, there are two pathways that are prevalent amongst children with ODD. The first is the early onset condition. This occurs, of course, in early childhood and progresses into middle childhood and adolescence, and this onset typically predicts a poorer prognosis and more severe long-term outcomes such as conduct disorder or antisocial personality disorder. The late starter pathway actually comes on during adolescence, and this is more influence from the peer environment and a new setting. So this results in a better prognosis in the future due to previous experience in adjusting to one's environment and a later start of disruptive behaviors. So in addition to this, we need to consider the results of parenting on the development of someone with ODD. Specifically, a lack of parental warmth and critical parenting styles have been heavily associated with the development of insecure attachment. And as a result, children who are insecurely attached develop these maladaptive behavioral patterns and difficulties in internalizing and externalizing emotions as a result of this insecure attachment. And this, as a result, creates behavioral problems. So in addition to this, if we have a hostile family environment that doesn't encourage stable parenting practices, we're going to see the increased severity of this condition and less promotion of emotional regulation. So another thing that has a very heavy impact on ODD is gender. ODD overall is more common in boys than it is in girls, and this is specifically related to early onset ODD, which is much more prevalent in boys. However, with girls, we do see the prevalence evening out between boys and girls in adolescence. boys are more likely to be exposed to more hostile and aggressive parenting practices, and this is thought to be heavily influential on their development of disruptive behavior. Next, if we look at the South African context, we can consider ODD to be incredibly significant. So we find that oppositional behavior is prevalent within childcare services in this country, as well as educational contexts, which has a severe impact on the quality of education and the quality of life for children in these situations. It is thought that low socioeconomic status and the disruption of the family unit can contribute to ODD, and this can be seen quite frequently in South Africa. There are some considerations when looking at South African expressions of ODD. Firstly, some families believe that oppositional behavior is due to spiritual disturbances, and these cannot be resolved therapeutically. So this has implications on how to approach ODD treatment. Then there is also the consideration of how teachers are influenced, and they are often unable to control children in the classroom due to defiant behaviors. However, they are also expected to be responsible for this discipline. And finally, we need to consider the impact of trauma in the South African context. There is a lot of influence on trauma in South Africa, specifically gender-based violence, crime, and other forms of abuse are prevalent in this country, and so that may encourage the development of ODD symptoms. So the impact on families is quite significant, with parents reporting an increased experience of stress and feeling overwhelmed. And these difficulties in coping with children with ODD actually encourages things like divorce due to interparental conflict. Parents often feel frustrated and also feel isolated from their wider family as the greater family withdraws from the child with ODD. So there are multiple prevention strategies that have been found to be effective when talking about ODD. The first is parental management training. This is quite a common technique and involves early intervention with difficult children or children with some form of traumatic background, where parents are educated on appropriate parenting practices and how to develop coping skills to manage conduct problems. In terms of cognitive behavioral therapy, this can be quite effective in encouraging situational awareness and appropriate responses to difficult situations that may be lacking in children with ODD. And finally, multidimensional systemic approaches include the involvement of community and external structures to try and better educate individuals on the best practices of managing children, specifically vulnerable children, in promoting pro-social behaviors and discouraging disruptive behaviors. Thank you very much for listening to this presentation. There are some references. I hope you found this informative, and thank you very much.